Hello, everyone. My name is Abi Adis. I am a graduate student for business informatics with the graduate certificates in health informatics. It has been a very interesting semester so far. I only had only one class during the first term, and I'm taking four classes this term. Because of that, my week was very busy, as you can imagine. But I'm trying to get there. Well, I am married and a father of three beautiful daughters. I live here in Louisville, Kentucky. I've been here 15 years in Louisville, Kentucky, actually. Uh, I studied economics and computer science as undergraduate, and I've been in different industries, working from logistics up to banking, you know, every different places. Finally, I decided to be a business analyst, specifically in the healthcare industry. You know, and I'm trying my best to get ready for that kind of new situation. And this class, evidence-based healthcare, I'm very interested uh, in this kind of study. During my undergraduate economics program, I had a couple of classes in regards to healthcare, economics of health specifically, and some other sociologically related classes. And I was very fascinating with those. Uh, Personally, it makes me fulfilled when I invest myself helping individuals, families, and society at large. So I believe this class is not, uh, fulfilling the class requirements for my graduate certificate, but it is to my liking to be able to investigate and dig more insights from different professionals when it comes to research and development of better healthcare systems. For the sake of this week's discussion, I tried to review few articles in the provided journal, and I come up with two important questions, I would say. I hope you guys going to find them helpful and interesting for your further consideration. The first question I come up with is the possibility of telemedicine in developing countries. I personally wonder how possible it would be telemedicine, the one which is becoming helpful and contributing a great deal of quality improvement in the developed nations. But my concern is whether it can be helpful in the developing countries where there is limited precondition uh, to facilitate this as alternative procedure of healthcare providing to extended uh, possibilities. My second question is how to overcome medical terminology challenges in language interpretation. You know, myself, English is my second language, and my close family members, relatives, and community members, they have difficulties to express themselves in English, including in daily lives, live alone when it comes to medical attention. So they seek language assistance uh, from people who are capable of translating their mother language into English and vice versa. But I observed during my involvements in that kind of community service, there is a significant barrier of the medical terminology. Even though individuals who translate different mother languages into English can successfully convey the message uh, in daily language perspective, but when it comes to medical condition, I observed and experienced that there is a significant challenge to really uh, convey the message according to the expectation of the medical provider. So uh, I went to Google Journal to see if there are some articles written to address the questions, and I was actually hopeful, and I found quite a bit of articles that can address these questions. But I was actually motivated by a couple of articles in the healthcare journal, in the healthcare informatics journal. For my first question, which is possibilities of telemedicine in developing countries, I was motivated by the article about contextuality of digital healthcare in Uganda, which is a good example to my background. I'm from East Africa as well, so Uganda is very close to where I'm at. So there is a good observation in digitalizing of medical services in Uganda. So it draws an attention for me to come up with formulation of this question, whether telemedicine is possible in developing countries. So I went to Google Scholar, like I said, and I found several articles, and they all indicate that it is possible, but they come up to identify three important challenges that needs attention by the government and other stakeholders. Number one is lack of expertise. That is obvious. Even in developed countries, there is considerable challenge when it comes to expertise to know how to manage, the digital tools and instruments. The second one is inadequate internet access in developing countries. Without having adequate internet accessibility, it is not easy to manage telemedicine from a specific place to extended rural areas. And the third challenge is the financial possibilities to administer the needs. When I come to my second question regarding the language barrier in translating language translation, I also found relevant articles in Google Scholar that come up with great insights and recommendations. So using industry personnel for translation purposes happen to be one of the good solutions. Training individuals adequately in the medical terminology is also a second option. But instead of hiring somebody from a different industry, hiring a nurse or any other medical professionals to translate languages is very recommendable, and it has a great deal of result. And when systems need to hire interpreters, they have to provide them adequate training that has enough or sufficient content of medical terminology. There could be also another solutions, but still, with the growing demand of language interpretation in relation to movement of human beings at this time, there is still relevant attention for further research, and the financial side of that is also in need of further studies. I hope this delivery brings some kind of interesting points to your attention, and I will also review your postings, and I wish you the best semester. Thank you.